Good afternoon, everyone, or good morning from wherever you're joining us. We welcome you to our first plenary session for today, the School-Based Healthcare Workforce Crisis, National Organizations Perspectives. I'm Andrea Shore with the School-Based Health Alliance. We're very excited to have representatives from national organizations across the school-based healthcare field today. It's my pleasure to begin by introducing my colleague, Laura Bray. She's our Chief Operating Officer and our Chief Strategy Officer at the School-Based Health Alliance. Many of you know Laura, as she's been with the School-Based Health Alliance for over 20 years and with the school-based healthcare field for even longer. Laura is going to kick off the session and introduce her co-panelists. Welcome, Laura.
Hi. Thanks, Andrea. Hi, everyone. And thank you for joining us today. First, I'd like to start with a little reflection. So today on TV and social media and in print, all of us hear about the COVID pandemic's impact on the healthcare workforce. Risk, stress, long hours, and burnout lead to an exodus of staff resignations, new careers, and early retirements. Even Jim McCrae, our plenary speaker from yesterday, mentioned the workforce crisis and some of the activities that are going on in the public health sector. But those of us in school-based health centers and other school-based healthcare roles witness and feel this crisis every day too. This crisis existed before the pandemic due to inadequate funding for our positions and those needed to meet the student needs, especially those who attend the Title I schools where most of us work. Non-competitive salaries, lack of diversity, and new graduates from all professions not entering the school-based healthcare workforce are other reasons for this. So today we'll discuss the state of the school-based healthcare workforce, the reasons for the crisis beyond what I've already talked about, and the strategies being employed by school-based healthcare professionals to retain and grow the school workforce. Next slide. SBHA is very excited to have 4 of its board of director partners and the national organizations represented today on today's call. Our distinguished panelists include Robin Wallen, Director of the School Health Division for Fairfax County Health Department in Virginia, and she is representing the National Association of School Nurses, they are also holding their conference as we speak in person in Atlanta. So we're so glad that Robin is able to join us for this plenary. Our second panelist is Kathleen Minke, Executive Director of the National Association of School Psychologists. Jill Cook is our third panelist. She's the Executive Director of the American School Counselors Association. And our fourth panelist is Rebecca Oliver, Executive Director of the School Social Work Association of America. Each of these panelists possess extensive experience in their professions in education and in school-based healthcare before assuming their national leadership positions. If you'd like additional information on each of them, please visit the speaker section of the Socio Platform app. So now, we're going to move to the next slide, and we're going to talk about a workforce status report from each of the professions that are joining us today. First, I'd like to invite Robin Wallen, our National Association of School Nurse representative, to give a workforce status report for school nursing.
Thank you, Laura. I am happy to have this opportunity on behalf of the National Association of School Nurses to share a bit with you today about the status of the school nurse workforce and some of the challenges that we are facing. NASN recommends that every child have access to a school nurse who is a full-time baccalaureate prepared registered nurse. NASN has moved away from recommending a set ratio of school nurses per students, however. The recommended school nurse workload is honestly more complex than a ratio and is a student health equity issue. Current best practice for staffing involves analyzing complex factors, including the number of students, certainly consideration of social determinants of health that impact students and their families, student health acuity levels, such as rates of chronic illness and other health concerns, prevention and wellness resources and barriers to care in the community, and structures that enable quality, efficient, and safe care. There are challenges in collecting data on the number of school nurses and where they're located, and there's no standardized infrastructure for this data collection. A study in 2018 indicated that 18% of public schools in the US do not have any paid nursing services at all, and that rural schools are less likely than urban schools to have a nurse. This study also noted that more than half of the school nursing workforce served more than one school. The best data that we have on the national school nurse workforce, comes from the NASN National School Health Data Set. Every student counts. But there's uneven state participation even in this data collection. Updated data will be published this fall, but what I'm sharing with you here today is from the last survey in 2016. There's an estimated 132,000 practicing school nurses serving about 74 million youth under the age of 18 in public and private schools in the U.S., with the full-time equivalent being approximately 95,776. School nurse coverage differs significantly by region of the country, local and state priorities, funding streams, and mandates. Currently, each state determines if there's any minimum requirements for school nursing staffing, with most states not having any mandates in place at all.
Great, thanks, Robin. And so we're going to have our next slide, and we're going to hear from Kathleen Minke on the status of school psychologist workforce.
Thank you, and thank you for inviting me to be here today with this distinguished panel. We have a recommended ratio of school psychologists to students, and the recommended ratio is 500 students per school psychologist. There are very few places in which that ratio is currently being met. Our best data suggests that on average, it's a little over 1,100 students per school psychologist, but that average obscures some really dramatic differences across the country with respect to, there are places where there are, more than 5,000 or 6,000 students per school psychologist. And you can imagine what impact that has on the ability to provide any kinds of services, really. And then there are a few spots where the ratios are quite favorable. We don't have great data on the number of school psychologists. We've only recently been able to start getting some federal data that's actually specific to school psychologists rather than just more general, either mental health providers or psychologists more broadly. But we estimate that there are approximately 43,000 400 or so FTE staff around the country, and we have even worse data when it comes to trying to understand, what are the numbers of unfilled positions. However, we do know that every year there are multiple positions that remain unfilled. There are particularly hard to staff areas, most notably in in under-resourced urban districts and also in under-resourced rural districts, with the key word being under-resourced. That really they have positions that go unfilled year on year. We have estimated a number using some fuzzy math about the number of school psychologists who left the field in the data that we have are from 1920, and we estimate around 3,000 left the field, or around 7%, and that's fairly comparable with the other school-based professions.
Okay, great. Thank you for that presentation. And now we're going to hear a little more from Jill, and she's going to tell us what it looks like for school counselors.
Thank you so much, Laura. Would it be possible to get my slide up there to speak to? That would be great. So like NASP, ASCA does have a recommended ratio as well. We recommend one school counselor for every 250 students. And like all the professions you will hear from, the national average certainly does not meet that. The current national average is 1 to 415. So we do know we get our data from the National Center for Educational Statistics, and we have ratio data going all the way back to 1986, when we had approximately 67,000 school counselors and a ratio of 588. Today, we know, as you can see, approximately 118,902, so almost 119,000. That number over the years has continued to grow. And the ratio has continued to decline, which is good news. And while the National Center for Educational Statistics data may not be the best bet in terms of completely accurate information, it is the most consistent source we have to track this data across the years. So knowing all that, knowing our ratio, we know we would need 200,000 school counselors to meet ASCA's recommendation. And as we're going to talk about, we know we don't have those professionals to fill those positions. One of the outcomes from the pandemic has certainly been more attention on student mental health. There has been more federal funding, more state funding, more local funding for all of our positions. But as we'll discuss, we're finding for the first time ever for school counselors, we do not have enough individuals to fill existing positions. And as you can see from the Bureau from Labor Statistics, we do continue to anticipate continued growth for the school counseling profession. So I'm looking forward to the conversation and how we can talk about possible solutions and things, best practices about how to increase the pipeline for all our professions.
Great. Thank you, Rebecca, for that. So now we're going to hear, I'm sorry. Thank you, Jill. I'm sorry, I'm confused myself. So thank you, Jill, for that presentation. And now we're going to hear from Rebecca, who's going to talk to us about the school social workers.
Thank you, Laura. Thank you. Yes, you're correct.
Okay. I'm sorry if I got mixed up there for a minute.
That's all right. Thank you so much. I'm thrilled to be here today and appreciate the opportunity to speak with everyone about this. Certainly, school social workers wish to have a school social worker accessible to each and every student in our schools, but we know that that is not the current situation. WA, like ASCA, has a recommended ratio of 1 school social worker to every 250 students, as is indicated in the NASW School Social Work Standards. Current ratios, as you've heard from some of my colleagues already, current ratios vary greatly by state. Also, even some of the federal data is inconsistent on reporting these ratios. In a recent report in some states regarding school social workers, the ratio is as high as 1 to 13 or 14,000 students. In this same report, it indicated that school social work ratios are the highest among SIS, farthest, in other words, from the recommended national recommendations in 41 states. And in another 5 states, the data is not even available. The national data varies as well. In the most recent data available at the national level, the estimated ratio is 1 to 700, which is 3 times the recommended. But additionally, in another report, the estimated ratio for school social workers was 1 to 2,106, which is much closer to some of the reports by state. This recommendation, however, is nearly 8 times the recommended ratio. Less than 3% of schools meet the school social work ratio recommendations, and 0 states currently meet the recommended ratios. Some of the data indicates that more than 67,000 schools report no school social worker, And similar national data indicates that 26 million students have no access to a school social worker. School social workers certainly have a unique set of skills, making us a vital part of this wonderful multidisciplinary team that we see here today. Right now, school social workers are seriously underhired and therefore underutilized to meet the needs of students, families, and school communities. The number of school social workers employed in public schools, by best estimates, is right around 33 or 34,000. Reliable data is not available on the number of positions that went unfilled last year or regarding the number of students who've left the profession. However, anecdotally, we believe that there have been far too many departures from schools than any of us would like to see for any of our respective professions. We know that the schools are a very important place to have our professions represented so that students can have their needs met. We anticipate similar exit rates to the other school professionals and my colleagues that are here today, as well as the exit rates we've seen for teachers and administrators as well.
Thank you, Rebecca. And thank you, all of you, for this. And before we go to the next, our very first question, the next part of our panel, I just want to comment on how you can see that there's a lot of estimates, or our census, as we may call it, or our data it's not integrated together. It's not mandated federally like NCES, the National Center for Education Statistics, is. And so I'm putting a pitch out there that in order for us to respond to the workforce crisis, we need really good, reliable data, and we need funding to do that. And we're not sure where it's going to come from, but all of us on the screen today through the School-Based Health Alliance feel that's a very important piece that needs to take place so that we can demonstrate why we, not only what the status is, but what we need in order to meet the demand. Because as we've all mentioned, there is additional money that's come in you throw money at education, or you throw money at school-based health services. However, we still have to have a workforce that gets trained to do this work. And so in order to know what's really needed and all that, we need a little more than just some money. We need some other things. And we'll talk more about that as we move forward. So let's go to the next question, or our first question. So I'd like to ask Robin, Kathleen, Jill, and Rebecca to join us on the screen we're going to just, after we read this question, we'll drop the question. We're all going to talk about this. So what are the primary reasons that anecdotally, or if you've done a survey or surveys, the reasons for each of the professional departures you're hearing about, that we know about? So let's start with Robin. Can you talk about the reasons that you know of for the school nursing departures?
Sure. I think there's several drivers that are contributing to workforce challenges in school nursing. This includes, of course, the impact of the pandemic, but also the broader nursing shortage in this country. And school nursing salaries are often not competitive with other nursing specialties. The COVID-19 pandemic has had a negative impact, just to be clear, on the entire nursing profession. Nurses have left the profession due to burnout and exhaustion. And working in schools during the pandemic has likewise been very stressful for school nurses, and some have certainly left because of this stress. Many school nurses have had primary responsibility for contact tracing and ensuring isolation and quarantine protocols are adhered to in their school communities, on top of the work that they're already doing with the care of sick and injured and helping with care coordination for chronic conditions and many other activities. So this has been a real burden. A study of 977 K through 12 school nurses conducted by the CDC Foundation last year found that 98% of nurses surveyed felt prepared to respond to the COVID-19 pandemic, but 68% also reported an increase in their responsibilities. 73% reported increased work hours, and 61% reported more stress in their work. Especially concerning was that 47% reported that they were thinking more frequently about leaving school nursing. Moving forward, I think it'll be very important to acknowledge and address the work stressors that have been brought on by the ongoing management of the pandemic in schools in order to reduce the number of nurses that are leaving school nursing. Another workforce concern is the broader nursing shortage in this country. According to a study published by the American Journal of Medical Quality in 2018, before the pandemic, the United States Registered Nurse Workforce Report Card and Shortage Forecast, a shortage of registered nurses is projected to increase over the next decade, with the most shortages in the South and the West. Certainly contributing factors to the nursing shortage include nursing school enrollment that's not growing as fast as the projected need, a shortage of nursing school faculty, which is restricting the ability to have students in programs, and a significant segment of the nursing workforce is nearing retirement age. And this is especially true in school nursing. The average age of a school nurse in this country is estimated to be 51.9 years. So as you can see, these are all things that are contributing. Salaries, as I mentioned before, are another concern for maintaining an adequate and skilled school nursing workforce. U.S. News and World Report has reported that the median nursing salary in this country in 2020 was $75,330. And even though nursing salaries rose for some specialties during the pandemic, school nurses are still among the poorest paid nurses in this country, with median salaries well below national averages for registered nurses. Some school nurses have left school nursing for more lucrative positions elsewhere. An example of this in my community were hospital systems that offered sign-on bonuses of tens of thousands of dollars, luring nurses working in the community back into acute care settings. So these are all really important drivers.
Yes, thank you, Robin. That's a very, very good synopsis. So I'm interested. We'll get to the next groups, and then we can talk about, so what do we do about this? So let's hear from Kathleen on the reasons you're seeing for school psychologists.
A lot of overlapping things with what Robin has mentioned. I mean, certainly the pandemic, our members reported, they were basically being asked to do their jobs in a completely different way than they'd ever done them before. Remote work was not a thing in school psychology, particularly. And suddenly you had a lot of school psychologists trying to operate remotely in ways that they had never done before. Since we've been back in school, you all read the papers too, the increase in kids experiencing anxiety, depression, suicidal ideation, suicide attempts. All of the data suggests that kids are very, very stressed, and not surprisingly, their teachers are also very, very stressed. And I think that we sometimes forget, the extent to which, because the pandemic affected everyone has had losses in their family, everyone has had illness in their family. So the adults who might normally be expected to be kind of in a little bit better shape to help kids who are experiencing stress, they're also under extreme stress. And all of that contributes to burnout for school psychologists and other mental health service providers. There's not a lot of data. There's some research that has been done that talks about administrative pressures and kind of those work structures that are not really set up for success. And the shortage plays into that because, again, when we have mandated services such as identifying kids who may be eligible for special education services, those mandated services will take precedence over prevention and consultation and some of the more systems level work that can make things less stressful, but you have to have time. It's the metaphor about we have to stop trying to pull kids out of the river. We need to go up the river and figure out where they're falling in, and that is very difficult to do when you have a workforce shortage. So all of those things sort of work together to make folks, make different choices, and with respect to their their work lives. And again, many school psychologists are women of childbearing age, and many of those women are not receiving support, and many of those women have left the workforce. And there's no real sign that they're coming back in any great numbers.
Okay, well, thank you. Let's move on to Jill and reflections from the school counselor perspective.
Well, thank you so much. And as Kathleen said, very similar for the school counseling profession as well. But one of the areas that hasn't been mentioned that's a deterrent for folks entering this profession is increasingly becoming the cost of the degree and the time it takes to earn the degree. In all states but 2, you have to have a master's degree in school counseling to be certified or licensed in that state to work in a K-12 public school. So folks are weighing those options and looking if the financial investment is ultimately something they want to choose to participate in. We know certainly there are more opportunities in terms of virtual instruction now that we've all learned how to do over the last 2 years. And some schools and universities had that in advance of the pandemic. But those programs that are full-time 2-year degree programs where people couldn't work, that is a distinct barrier that we have increasingly heard about. And as we've heard too, the last 2 years, and we've heard anecdotally, this previous school year in particular has been just very stressful, the 21-22 school year, and there is a lot of burnout and exhaustion. And as Kathleen alluded to, just we can't negate the toll that the pandemic has taken on the adults and the educators in the building, and how we certainly want to talk about how we support the children and the students, but we also as a school system need to think about how we support the adults as well. And so school counselors are leaving, they're tired. And something else we heard and is safety. And this was even information we had heard from our school counselor members prior to the Uvalde school shooting. As we are back in school full time and we continue to hear about mass shootings, there's real concern for safety. And then the salary and the earning potential. In 2018, the Bureau for Labor Statistics had the average school counselor salary at $56,310. So the potential for earning is also something that often precludes individuals from going into the profession.
Okay, thanks, Jill. And now bringing up the rear, we're going to hear from Rebecca about how this is impacting, the reasons for school social workers leaving the profession.
Thanks again, Laura. Yeah, a lot of, I'll be echoing a lot of the things that my colleagues have shared, of course. Data is being collected regarding the specific impact of COVID. We all know that and we've seen that, but we are working on collecting some data regarding the school social work profession. But unfortunately, as you all know, that data can take some time to pull together. But we are hearing 3 main factors that are contributing to school social workers leaving in an anecdotal way. The first being lack of the human resource. So there are not enough school social workers hired in the school setting to meet the rising needs of students, families, and communities, especially in light of the impact of COVID, the impact of racialized trauma, and now add to that the rising cost of gas, food, and housing. And so we know that those needs are plentiful. So school social workers, like my colleagues here, are all feeling stretched too thin, trying to meet the complex needs and the increased mental health concerns of students. The second factor really is a lack of understanding around the school social work role. The school's primary focus obviously is education and academic success of students. School social work has had a long history of serving as the link between the home, school, and community. School social workers work to address those barriers to learning that may include economic factors, food insecurity, insufficient housing, relational issues, mental health concerns, domestic violence, and all forms of trauma, just to name a few. When there is a lack of understanding of the role, school social workers can become discouraged and can feel hindered in their ability to do their vital role. And then the third one is burnout, perhaps an all too familiar term. However, when there are high caseloads, a lack of understanding or support for your role, and the needs are so high, the emotional exhaustion is real. In the last 2 years, school social workers have noted increased concern around the well-being of not only students, but also of the other school staff. And they have indicated that administrators have reached out to them to help in meeting the needs of students and staff around self-care. So this role carries with it the impact of secondary trauma. When schools are not creating environments that support the mental health of all school personnel, the whole system suffers and the workforce is negatively impacted. And in the Surgeon General's recent report on mental health, that was one of the points that was brought out in that report, was that building an environment that supports the well-being of all is really critical to addressing this mental health crisis. And as mentioned with my other colleagues, the salary as well is an impact, in that many school social workers are not even, in some states, are not even recognized for their master's degree, the 60-hour master's, and some of them are not even paid on a master's pay scale. So there's a lot of work to be done in that area as well.
Well, thank you, Rebecca. So let's move on to question number 2. And I think we've addressed a little bit of this, but if each of you have anything additional to add, let's do that. And then we're going to get to hopefully some strategies and solutions that we're working on. So let's start with you, Robin, and talk about what the current demand for additional workforce is in school nursing.
Sure. I mean, one of the things the pandemic has done is highlight the need for more school nurses and highlighted the impact that school nursing shortages have had on schools. While we don't have national data on the number of school nurses that are needed to fill vacancies for the next school year, I can certainly speak from my own experience in Virginia. In 2021, the Virginia legislature passed legislation that mandated a ratio of 1 to 1,000 for at least 3 disciplines of 5 categories of school support personnel. And our county chose to make school nurses one of these positions to meet that mandate, which meant adding an additional 82 nursing positions to our school health program. More than doubling the school nurses in our school district, which was awesome. However, we continue to experience turnover in our nursing staffing, and although we have engaged in very active recruiting for the past year, we still have 80 of those positions to fill. So, the registered nurses who could fill these or similar positions are they were in short supply before the pandemic, and certainly that deficit has deepened since we've gone through the pandemic. The American Nurses Association has noted that more than 500,000 registered nurses are expected to retire by the end of this school year, leaving a need for 1.1 million more nurses. So, just an incredible need. And despite the absence of centralized data collection processes of the school nursing workforce, there's certainly evidence that there's a significant inequity in the distribution of school nurses. There was a study in Washington State that noted that disparities in access to school nursing services mirror the gaps that exist for pediatric care along socioeconomic status and geography. And they also noted that the that having more school nurses in school districts with high needs did help to address the gaps in care for these populations. So school nurses certainly deliver care that reduces barriers for disadvantaged students, but there's more research needed to provide more evidence on how having access to school nursing services can impact student health, wellness, and academic achievement.
Great. Okay, thanks, Robin. All right, Kathleen, let's hear about the demand that you're experiencing for school psychologists.
And again, we have some data, not great data, but what the American Association for Employment and Education, they have some interesting charts where they show demand and the whether you have a balanced supply and demand, you have some shortage, or you have extreme shortage. And in every region of the country, we have at least some shortage. There's no area in which there is a balance between supply and demand. We estimate that to meet our ratio, we would need an additional close to 60,000 school psychologists. And we have somewhere around 220 graduate training programs, so you can do some math on that. It's grim. We have to figure out some ways to increase the availability of training, to increase the affordability of training, all of those issues. And one thing that we haven't touched on is that even if suddenly deans and provosts opened up the world and said, yes, we will train your school-based mental health folks, there are no faculty who are qualified to provide that preparation. So it's a challenge. It is a big problem right now.
It's interesting. I'm just going to do a side commentary. As Jim McCrae yesterday mentioned, that there's going to be a federal effort to bring retired physicians, offering them positions to come back and teach, or to work in certain settings, but more to come back and teach. I don't know how we're going to get them to come back, but we've got to.
Well, I can tell you, school psychologists are notoriously bad at retirement. They tend to retire and then they get back. So that might actually be an avenue that could be helpful.
Okay, well, let's keep that in our bonnets. Okay, but thank you for that update. And then Jill, how about school counselors?
Well, as Kathleen was saying, as she wrapped up, one of the issues we certainly have is not enough school counselor educators to train those in the graduate programs. Having somebody who's actually had school counseling experience be those professors in those programs is certainly an issue. And we know we graduate approximately 11,000 school counselors from graduate programs each year. But to get to the 1 to 250 ratio, we would need, in today's numbers, 82,000 additional school counselors to get at that 1 to 250. So we know, just given the number of graduates coming out, that that's not going to happen. And I know we're going to get into solutions. So, and as others had said, we see this, again, this is the first time ever school counselors have had a shortage. I've been at the association for more than 20 years, and we've always been in the rather envious position. We always had professionals to fill positions, but now we're grappling with this as well. And we're seeing it particularly in rural areas, in states where there has been an influx of funding, which is great news for these positions, but again, weren't prepared for that influx of funding. Their graduate programs weren't prepared. So now we're getting at people who don't have the proper certification or proper training being brought in to fill these positions. So lots to be done still on our end as well.
Okay. All right, Rebecca, school social workers.
Thank you. On an earlier slide, I mentioned that recommended ratio of 1 to 250, but the actual ratio being closer to 1 to 2,106. Also, available data indicates approximately 54% of students in public schools do not have access to a school social worker at all. So let that sink in. Over half of our nation's students do not have access to a school social worker at all. If we're going to care for our young people as they deserve and address this current mental health crisis, we need more school social work positions and personnel. Certainly, again, as echoed by my colleagues, that's going to be challenging when you look at the number of school social workers currently employed, and that over half of our student population has no access at all, regardless of even meeting those ratios. We're talking tens of thousands of school social work positions that are really needed. We all agree that there is a mental health crisis with our youth. And so we need a robust support from the federal government to allow comprehensive school mental health plans that include members from all of these groups represented today. Together, we can advocate to address the stigma associated with mental health needs and improve access to these needed services. School social workers have unique training using a systems, ecological perspective, and strengths-based perspective to assess and address mental health factors at the individual and family level, but also at the community, environmental, and society levels as well. School social workers have specialized training to consider factors of social justice, to stand in the gap with marginalized groups, and to ensure culturally responsive services are employed to meet needs. So we have a long way to go in getting these positions allocated for and then filled to meet the needs of our students.
Okay, well, thanks to all of you on this particular question. So I think we've heard a lot about what the workforce looks like, what is needed, the unmet need. And now let's turn to question number 3, which hopefully we can hear what strategies are currently being, next slide, Andrea, what strategies are currently being implemented to fill these vacancies or address the increased need. And let's start again. We're going round robin. So we'll go to Robin again.
Sure.
What kind of strategies are you hearing about taking place to, I know they're not going to be a panacea to cure everything, but what good, promising practices are you hearing about?
Sure. So, I mean, as I mentioned, I personally have experienced incredible challenges with recruiting, hiring, and retaining qualified school nurses. So one of the things that we have been able to do in our district, and I've heard other employers, is to offer a small sign-on bonus to attract staff. And so we have implemented that. Another strategy that we're employing in my health department is to create a school nurse residency program. So this program recruits, trains, and supports new nursing graduates who enter school nursing directly from undergraduate preparation, which is not the normal track that most nurses take into school nursing. We are hosting our first group of 10 public health nurses in this fall to work in school health. And I think that creating partnerships with universities and new graduates will certainly be critical in encouraging new nurses to join the school nursing profession, and definitely something that is replicable in other locations. And besides these local strategies, I think there's some other really important solutions to the school nursing shortage. I know it was mentioned before from some of the other presenters also, but there's just this growing understanding of the impact of stress on nursing professionals. And many programs are beginning to address staff wellness as an integral nurse retention strategy. So this includes providing resources for mental health supports for our staff and training for resilience strategies. Another strategy that became more common during the pandemic was acknowledging the workloads of school nurses and providing additional staff support for their work in school health. So we need to acknowledge, that school nursing is an excellent investment for our communities. There was a study in Massachusetts that demonstrated that for every dollar spent on school nursing services, society would actually gain $2.20. And this study only accounted for the cost of parents' time off work, teachers' time, and the cost of treatment. But school nurses also provide other cost-effective preventative services like wellness and disease prevention, early intervention services, including vision, hearing, and dental screenings. So working with diverse funding streams with local and state governments to understand and devote resources to school nursing services is gradually becoming a hopeful strategy to help allocate the needed resources. Full-time funded school nursing positions are critical. And in order for there to be security in school nursing positions, school districts need mandates for nursing that are funded beyond local education dollars. Funding to hire school nurses and retain them long-term seems to be lacking. Currently, over 3/4 of school nursing dollars are funded solely through education dollars. And when these are stretched thin, such as during the pandemic, school and district leaders often don't have the funding to hire and retain school nurses. So this opportunity to engage the broader health system in funding is key to student health, to school health services, and is a hopeful strategy moving forward also.
Great. Oh, that's encouraging. I like that. Okay, how about Kathleen? What about school psychologist strategies that are being implemented and are promising?
Yeah, I focused a little bit more on sort of what our association is doing, and I think it may be applicable to some of the other fields as well. I mean, we have developed a program of it's a pretty simple thing as far as a PowerPoint and some resource materials, and we have two versions of it, one that can be presented to high school students and one that can be presented to undergraduates. And so we've engaged a lot of our practitioners, also a lot of our graduate students are going out and doing these presentations to younger and younger folks. And we don't unfortunately have any data on impact. We know that for example, in the last year, there were nearly 3,000 individuals who learned about school psychology in this way. And that was but we don't really know, then how does that translate into the number of folks coming into the field? But that was one strategy that we've been working on. We also developed a what we call the second round match program, trying to make sure that every available graduate preparation slot gets filled with a qualified student. So a lot of times students will apply to a small number of programs, maybe right in their immediate neighborhood or whatever, and then they don't get into any of those programs. And then you have other programs that have, slots that are unfilled. And so either the university or, universities and students can sort of enter into this second round match. And we try to then bring slots together with qualified students, and that has been fairly successful for us. We've been paying attention to mentorship programs, particularly sort of student-to-student mentorship, particularly for students of color and from minoritized groups who are sometimes entering very traditional and maybe very culturally different, culturally white spaces that make it difficult for them to be successful. So having those mentoring relationships, we believe, can be helpful in keeping students in training. We do a lot of advocacy around paid internships, loan forgiveness, those kinds of things that make graduate education a little bit more affordable and possible. We also have a lot of guidance that we've developed for universities that want to start a new program. Sort of how do you do that? We're developing guidance for distance learning and those kinds of programs as well. As far as retaining folks, we do have our comprehensive model for the model for comprehensive and integrated psychological services, way too wordy. We just call it the practice model. But it does two things. For one, it outlines what a district should be able to expect a school psychologist to know and be able to do. So those domains of practice, but it also outlines really clearly the kinds of organizational structures that a district ought to be trying to promote in order to have a school psychologist be satisfied and happy in their job. And that, I think, again, is something that we're continuing to work toward helping folks build their systems. So I'll stop. I had others, but my time's up.
Great, Kathleen. Thank you. Very interesting. Love that. Okay, Jill, how about for school counselors?
Thank you so much. I'd like to speak to two specific state initiatives that are going on right now. One is in Oklahoma. So our association has partnered with the Department of Education in Oklahoma to provide a one-year training program for those who have an emergency certification as school counselors. In Oklahoma, it is something like 78% of the school counselors have some kind of emergency certification, which means there are shortages. Districts need school counselors, so they're giving these provisional or emergency certifications to those who may not have that master's degree. So we have a cohort. We're getting ready to enter into our second cohort in the fall, where we provide online module training over the course of a year to those to a group of individuals from those emergency certified, so they can have information, knowledge, skills that school counselors need to have to work with all students in a school. So we hope to expand that to additional states. We're working with a couple of additional departments of education across the country to make that happen. The other state is Colorado, that has done a couple of things. One, they have a severe shortage in their rural areas in Colorado. And when they saw the individuals who didn't have the certification being hired, our state school counselor association division in Colorado immediately started working with the Colorado Department of Education to develop a training again. So those that were being hired without the master's degrees in school counseling are going to receive some kind of training so that they have information and skills and knowledge. One of the other things that Colorado is innovative in so many ways. One of the other things they did just recently this spring is they had state legislation that passed for to provide a stipend for internships to those who were receiving their education degrees. And the state association was able to advocate and get school counselors included in that legislation. So they get a $22,000 stipend, while at the same time getting the hour requirements they need to ultimately have that master's degree. In addition, Colorado, they've had for 8 years now, a counselor corps, a school counselor corps, where the state has provided funding for additional school counselor professionals in the state. It started at the high school level, then went down to middle, and now is at the elementary. And one of the things they do that's great, they're working on the new one now, is the return on investment. They're showing the impact of that. The first one they did, I think the savings to the state in terms of the student outcomes was $300 million. So those are just two examples of some innovative things going on.
Great programs going on. Love to see the replicability coming forward, you know? Okay, Rebecca, how about for social workers, school social workers?
Yes, we continue to advocate for better data collection, which we've heard mentioned here a few times today, so that we can better understand where the needs are, so that we can come up with a systemic way to address that need and to fill those positions. Additionally, advocating for full-time funding for school social work positions and funding that's equitable in pay to attract those employees and to keep them in those settings. Additionally, an issue that we see often with school social work positions is they're often funded, or they can be funded on grant monies, which of course are not firm monies. And so it's challenging to get someone to want to take that position when they know it may go away. So we really need to have dependable federal funding for these positions, so that folks will be attracted to those positions, will want to fill them, and will want to stay in the school settings. Some other ways that we're addressing the need is continuing to work towards pre-service training, and so working with universities to address the needs of school social workers as they enter the field. Also, transitional training. We're seeing in a number of states where, as finally some more positions are opening up for school social workers, that school social workers are transitioning from community-based practice into the school setting. And so we're working with state DOEs and districts, which are seeing an increase in these positions in the school, seeing this influx of professionals moving from community-based settings and helping to support them in delivering needed training for school-based services. Also, working with our members and our state affiliate organizations to share any school-based job postings that are available and assisting in getting the word out so that qualified folks can fill those positions. And then additionally, through our organization, developing various trainings. We're working on an orientation course for new school social workers, so folks just coming into the field, mentoring opportunities, as was mentioned by Kathleen, for new professionals to firmly establish them in best practices as they're starting in the field. And additionally, school social work has launched in the last year or so national certification, which is now available to school social workers, indicating their mastery of the National School Social Work model and thus ensuring delivery of high quality school social work services in the school setting.
Okay, great. Thank you. All right, so we're getting close to the wrap up. So what I'd like to talk about is, I think it's great. We've heard so much from each of you about the needs and special along each certain profession. I'd like to just say a little bit about, from a school-based health collaborative or coordinating approach, what the School-Based Health Alliance also envisions. We support all these efforts. We think they're fabulous, but we also want young people to be educated about school-based healthcare, not just school-based health centers, but school-based healthcare, all the different professions and the opportunities that could be for them, and getting them started in a pipeline very young, like STEM education, but STEM for school-based healthcare. And so looking at how can young people get just the beginnings of entry point into technical school when they're still in high school, so they could learn more and become maybe they could become a medical assistant, or they could become a community health worker. They could begin to learn some of these skills. They could be mentored from an early state. If there were technical programs that could offer them free education to come back and work in their school as they continued their education onto other things, like being a counselor, even to finish their undergrad. If there's something they could do at the undergrad level, like provisional, but they could still be working in another profession in their own community, so that we begin to also look at ways to diversify the workforce. Things like that, we think it would be great to have some new innovative approaches like that. This is not something we will accomplish overnight. It is definitely at least a 10-year plan, along with a census too, to look at what are the needs of all the workforce. And in particular for us, we know every school needs these professions. However, the Title I schools, you've already mentioned, Jill, too, the cost of the return on investment. In certain communities, they're needed more than, they really need them more than others, and more of them. And how do we get young people that come from those communities to follow these professions, to be mentored in, and to be able to be successful? And for many of them, education and the cost of education is a barrier. So getting states to buy into paying for that education for them, so that they can have a pipeline of returning back to their work. There are several programs like this that already exist, not necessarily related to school-based healthcare, but related to healthcare in general, that have been successful. One of them is in New Mexico, one's in West Virginia. We'd like to see more of those kinds of programs going forward. But at that point, I'll stop, because we're still working with trying to get philanthropy to want to invest in this, and also maybe the federal government to help with some investments in that. So we're all in partnership with that aspect that would lead these young people into the other careers at a higher level, where they need their bachelor's and their master's. And in some cases, they may even need their doctorate to function in some of the professions. So I would like to close with This has been an awesome conversation. It has been great to talk with you all and work with you during this time. I want to thank all our presenters and thank the audience for participating. And I'd also welcome any of you to continue to have conversations about this as you move forward and thinking of, talk with all of us after the conference about other ideas or innovative approaches you've used or are seeing used. In addition, I also would like to remind all of you to please, I'm going to make another plug for this 2022 census. It's essential for us to have our school-based health centers counted. That's how we know what's going on in the field. And in addition, we also know how to advocate for the funding for this. But also it helps us look at the need and how we can continue to even develop the workforce. The census helps us with that as well. So we're at the top of the hour. Again, thank you all. And thank you all for attending. I want to tell you all that there's a break and then come back and join us for the next breakout session. Thank you.